My name is Trent. I am a clinical dietitian at the North Florida South Georgia VA.
My name is Taylor Sikes, and I'm a clinical dietitian at the North Florida South Georgia VA.
As a clinical dietitian, I help to provide diet education to lessen the severity or symptoms of chronic diseases that our veterans may be having. I personally help veterans in my position by providing them realistic diet interventions that they can provide. Not everyone can stick to the same diet recommendations, and I provide them with personalized recommendations that will fit for their life.
One of the holistic practices that Whole Health offers that kind of combines whole health with nutrition is a practice called mindful eating. This is where the veteran is really going to focus on the foods that they're putting into their bodies that will help their performance from day-to-day activities, such as focusing on the mouthfeel of the foods or the texture. How does it taste? How does this make my body feel right now?
I decide on dietary recommendations for veterans based on their willingness to learn and what they are capable of completing within my recommendations. I merge nutrition and healthy eating with the rest of the whole health program by focusing on what the veteran wants to work on and what they think is going to be important in their healthcare journey.
One really positive experience was I was working with a younger female, and she had pre-diabetes. And we went through her diet recall. She was super active in the gym, and she wasn't eating enough carbohydrates. So she kept having very low blood sugars every day, really bad migraines, passing out. And I showed her different ways to add more carbs to her diet and explained to her that carbs don't have to mean sugar. That doesn't have to be chocolate and candy and cake. It can be fruit. It can be, protein pasta. It can be protein pancakes. It can still have extra sources of protein in it, but we still really needed to up that carbohydrate intake throughout her day, keeping pre-workout snacks in her car, drinking Gatorade or Body Armor. And at our next appointment, she goes, "I just want to say thank you so much. I haven't felt this good in years." And I didn't realize the relationship I was having with food. I was so focused on low calorie, I didn't realize how the carbs were, or not having the carbs was impacting me. And she is just ecstatic to see me every time I get to see her now.